Hello, everyone, and thank you for joining us today for a Learning and Growing webinar on threats to academic performance among college students. Our presenter today is Jared Brown of Concordia University, St. Paul. My name is Sidra, and I'll be your moderator today for Hawks Learning. We will have a live Q&A session after the presentation, so please enter any questions you have into the Q&A module as we go, and we'll be sure to answer them at the end. I'll now hand it over to our presenter.
Thank you very much, and good day, everyone. I hope all of you are doing well. Today, we are going to be covering a ton of topics. So, best way I can put this is we're probably going to be covering a master's degree worth of topics in under an hour today. So, I really want to introduce you to all kinds of really important and complex topics for all of you to take into account when we're thinking about some of the variables that can negatively impact student performance within that college classroom environment. So my name's Jared Brown. If you have any questions you think of, type them in the chat box again. If you think of questions after today's training, reach out to me by email. I always get back to folks in a timely manner. If you've never heard me present before for Hawks Learning, I am a professor, trainer, researcher, and consultant. I have multiple certifications in a variety of topics related to health and wellness and sleep and nutrition, digestive health issues, amongst a number of other topics. And I'll try to weave in all of those kinds of topics into today's training. And I believe all of you have a copy of today's training description. So, what I thought to just do is lay this out visually for all of us before we jump deep in the weeds today. These are going to be the topics that I'm going to be covering today. I've given individual talks on most of these topics for different groups, so take this into account in terms of how quickly we are going to be moving through this content. A lot of these topics are literally 40 hours of content. So some of these are pretty heavy duty topics, but my goal is to make sure all of you are at least aware that these topics exist, how to define it, and then we'll save some time toward the end just talking about basic tips, strategies, solutions, interventions that you can use when working with students who may be impacted by some of these kinds of topics that we're going to be covering today. So there's all kinds of things that can negatively impact academic performance. When we start looking at this through this lens, think of some of the internal causes that may be going on in that student's life. So we need to consider it could be mental health problems. It could be an undiagnosed learning disability. Maybe some of your students are dealing with chronic sleep issues, chronic body pain, even sensory issues we need to take into account. Students with sensory issues might be overwhelmed by bright lights, lots of background noise. Even certain colognes or perfumes can impact students that have sensory deficits. But equally important, we also need to take into account what's going on externally in that student's life, where they live, socioeconomic status. Did they grow up in a home where there's a lot of abuse and chaos? For some students, maybe they have a screen time addiction that can absolutely impact academic performance. We're going to dig deep into most of these topics today. And again, let me know if you have any questions. At the bottom of each of my slides is my full citation. And if any of you would like a copy of my slides, just shoot me an email and I'll be more than happy to share them with you. But there are really just numerous articles that have been published over the past several decades that look at the fact that unfortunately college students may live more of an unhealthy lifestyle compared to the general population. Some research points to that. And some of the reasons for that may be their eating habits. We're going to talk about dietary practices a little bit today. It's pretty clear from the research literature that college students consume way more sugar, consume alcohol in some cases more than the general population. For some students, they are working all night long, going to school all day. We're going to talk about daytime fatigue. We need to consider circadian rhythm misalignment. That is very common among people who work overnight shifts and maybe don't get a lot of sleep at night and they're up during the day and night. We'll talk about all these today, I promise you. And the research is also pretty clear on this that stressors are typically going to be more common among some college students. If you look at the research literature related to college students and stressors, what it says is as people become more independent, that could actually be an increased stressor for some people because of increased responsibilities. If you were part of that training I did, I believe last month or the month before for Hawks Learning, we talked about academic procrastination. That can be a huge stressor for some individuals. For some college students, again, they're trying to navigate that school life with work life and trying to creating a balance there. And if the student has poor time management skills or organizational deficits, that can absolutely be a factor. Unfortunately, too, the research is pretty clear on this too, that an elevated number of college students may be dealing with increases in depression, anxiety, and other kinds of mental health related concerns that need to be taken into account because all of these things can absolutely contribute to poor academic performance. The first thing I really want to dig into is let's just do a little discussion about what the research says in terms of food consumption among college students. Again, every study is different, but if you look at the studies as a whole, college students are large consumers of fast food. And if you've really dug deep in the weeds with fast food consumption literature, you're probably quite aware of the fact how this truly is a threat to human health and wellness and how it can have a profound impact on our brain, on our memory, on our learning. When people consume a high degree of fast food, they're typically getting lots of sugar, lots of sodium, lots of processed kinds of ingredients. And for some individuals, depending on the frequency of this kind of eating, it can wreak havoc on their brain and body. If you're interested in studying this at a deeper level, I would recommend looking at like ultra processed food literature and becoming familiar with the Western diet literature. So, this is what the research says in terms of fast food. Again, if you look at many college campuses around the United States, students have access to lots of kinds of processed fast foods. That is very, very clear from this research literature. And unfortunately, excessive consumptions of fast food have been related to increases in weight gain. It can impact blood sugar dysregulation. We'll talk a little bit about that today. It's been linked with having more sleep problems, more anxiety, more depression. The list goes on. So, fast food consumption is a threat to human health. The research is pretty clear on this. And when we're looking at this through that dietary lens, people that consume a very high degree of fast food oftentimes are also consuming higher amounts of sugar. And a lot of times that's through sugar sweetened beverages. And I did do a training on sugar sweetened beverages and the impact it has on college students for Hawks Learning. I recommend checking out that recording. And then also being aware of excessive caffeine consumption. We know from the literature as well is college students have a tendency to consume a higher amount of caffeine. And part of the reason is trying to juggle that work life balance, trying to stay awake, trying to combat their fatigue to get their homework done. But unfortunately, excessive caffeine consumption has also been linked with a number of different health related issues. I do a lot of work in the area of the gut brain health axis, which is basically digestive health issues and what role that plays in brain functioning. And there's actually a handful of studies that have found, at least according to these particular studies, that college students may have more digestive health issues. The reasons for that is poor dietary quality, not getting enough sleep, Excessive screen time exposure can impact this. If you're a college professor listening to today's presentation, sometimes people wonder, why should I care about the gut? Because of the gut brain health axis. If the gut is off, that is an indication that the brain is not working at optimal levels. There's a bidirectional communication between what goes on in the gut and what goes on in the brain. And one tip I'll give you, if you want to optimize brain functioning, improve the gut health. Again, these are huge topics. There's literally been thousands of studies published on the gut brain health axis over the past several decades. But just to spend a minute on this, there are multiple things that can negatively impact the gut. Again, what we eat, even who we associate with. If we're around people who are very mean or rude or disrespectful, that has been linked with more gut problems. Working long hours, especially shift work, can throw off the gut. Certain kinds of medications, particularly high amounts of antibiotics, people that smoke cigarettes, people that deal with high levels of psychological stress. These are just a few things that can adversely impact gut functioning. Food insecurity is another big topic. I'm actually putting together a training on this topic as we speak. Food insecurity has been shown to be very common among college students. I was shocked to learn how many studies have actually been published on this. You will literally find well over 100 studies that have been published specifically on food insecurity within the context of college students. And what the research indicates is that when food insecurity is going on, this can absolutely have a very negative impact on academic performance. So the question is, what is food insecurity? This does not always mean like someone is not going to have food. That could be a factor in some of the cases, but basically, food insecurity means that the person probably doesn't have access to high quality, nutritious foods. A lot of times, people that are dealing with food insecurity may rely more on processed foods, gas station foods, drive-through foods, foods that maybe taste good, but they're loaded with sodium, they're loaded with sugar, preservatives, and the research again is very clear on this. People that deal with high levels of food insecurity over a long period of time are at an increased risk of obesity, diabetes, hypertension, having a negative mood state, so increases in anxiety and depression. The list goes on and on and on, unfortunately. Another factor we need to take into account is blood sugar dysregulation. I do a lot of work in this area as well, especially through a forensic mental health lens. When our blood sugar levels become dysregulated, and this can happen from skipping meals, which is very common among student populations, they may skip breakfast. That can have an adverse impact on blood sugar regulation. If someone consumes an energy drink or has fast food for lunch, that can spike our blood sugar levels. And in the mental health literature, it talks about one of the best things we can do to support our emotional health is to keep our blood sugar levels regulated. Easier said than done. There's a multitude of factors that can impact blood sugar dysregulation. The very nature of not sleeping well can throw off our blood sugars. Excessive caffeine intake has been linked to this. Obviously, lots of sugar, binge eating, but even living a sedentary lifestyle. So, people that don't get a lot of exercise and just lay around a lot of times may have more blood sugar dysregulation. So, this is a big topic I think we should all be aware of because it also has a lot of implications for brain functioning and learning and memory as well. Chronic pain is another factor that could be a potential threat to academic performance. We know that chronic pain issues, unfortunately, are very common in the general population, but they're also more common too among certain college students, especially if college students might be in high impact sports. We need to be aware of that. Chronic pain is basically, think of it as ongoing. It's not kind of a short-term thing, but chronic pain has been linked with more sleep problems, more concentration issues. It's been shown in some cases to impact memory. It can increase depression and anxiety and fear and worry for some people. And when you think of chronic pain, a lot of people think of like joint pain, back pain, but chronic pain can come from acid reflux, fibromyalgia, chronic migraine headaches, nerve damage. If you've ever worked with a student that's had a traumatic brain injury, that could be a factor in some of these cases. And interestingly, on a side note, chronic pain is one of the main reasons why people in the United States may go to their healthcare provider. Executive function, I'll actually be doing a training next month just on this topic for Hawks Learning. This is the number one topic, in my opinion, that relates to academic performance in terms of learning. If you're a college professor or any kind of educator, learning as much as possible about this topic is imperative because executive function is referred to as the boss of the brain. It plays a critical role in decision making, problem solving, reasoning, time management, organization. These are all skills that are vital for students to be successful within a college environment. And there are all kinds of things that can negatively impact executive function: stress, sleep issues, alcohol consumption, again, what we eat. Even some students that are dealing with divided attention, where they multitask constantly, that could have an adverse impact on our executive functioning capabilities. And again, I know I'm covering a lot of information and throwing a ton at all of you. Let me know if you have any questions, if there's anything I can clarify or go deeper into. If you work with students who have slow processing speeds, which might be more common among students that might be sleep deprived or dealing with a lot of anxiety or depression, this is an aspect of executive function as well. But think about this: if you're in a classroom giving a lecture and there's a student in there that has slow processing speed, think of that as a traffic jam in that student's brain. They can't take in a lot of information. They need extra time to make sense of what's being said to them. Again, there's all kinds of things that can adversely impact this: insomnia, sleep apnea, sensory issues, the list goes on. Metacognition is a huge topic as well that I believe all educators should learn about. Basically, what this is thinking about thinking and knowing about knowing. It's a very high level cognitive process, and we always use it when we're thinking, we're trying to carry out a task, we're trying to connect the dots. When students have deficits in the area of metacognition, this can get in the way of all kinds of things: attention, learning, memory, problem solving, the ability for a student to monitor their own behaviors within that classroom setting. This is a big topic as well. I would highly encourage you to get some more training on. Self-regulation is that ability for us to kind of put on the brakes and pause and recognize and monitor our own thoughts, feelings, and behaviors. This plays a critical role in academic performance. So when we have better self-regulation, we typically are going to be able to get our homework in on time. We're going to be more planful. We can set goals more effectively. We typically can solve problems more effectively. I give a lot of talks on self-regulation to different groups. And just on a side note, there are some studies that indicate that self-regulation deficits may play a role in as many as 40% of all deaths that occur every year in the United States. This is a very important topic. It plays a role in our driving behaviors, our relationships, money management, what we eat. If we get angry, can we put on the brakes and pause and reflect and think through our actions? Or do we have poor self regulation and are more impulsive, and we really don't think through our actions and we just say the first thing that comes to our mind. Self-regulation again plays a very critical role within the classroom. And it also plays a very critical role with time management. So if you've ever worked with clients or students that have very poor time management abilities, that is likely an executive functioning impairment, partially driven by maybe self-regulation deficits. So I'll give you a couple tips when we think of time management. Does that student know really how to estimate time? I do a lot of consulting on complex cases with different groups around the country, and time management does come up from time to time. If you're ever working with someone that has true time management deficits, do they have good time awareness capabilities? Can they estimate time effectively? And then how do they carry out the task by using time? So, for examples, if you are working with somebody that has time management difficulties, do they really know what the difference is between a day, a week, and a month? For some people with time management problems, they can really struggle with estimating time. So, making time very concrete, making time visual. And if you notice students that never seem to turn in their work on time, dig deeper. That is likely partially driven by potentially executive functioning impairments. When you think of time as well, we won't spend much more time on this, but when you think of time, think of all the words that are used to describe time: before and after and later and long ago and morning, noon and night. This is a really complex topic that I don't think people truly realize. Symptoms of poor time management can be students that are always rushing through things. For some students, they might really struggle with multitasking. They may come off as very disorganized in their thoughts and even in how they carry themselves in the classroom. Poor time management, in some cases, can be related to higher levels of perfectionistic behavior as well, and just a poor work life balance. When you talk about time, you also need to take into account organizational deficits. And another red flag indicator to be aware of when you're working with students is if they are completely disorganized, that is also likely partially related to an executive functioning impairment. So, very important to take that into account. This is a topic that I don't think people have heard a lot about or have had a lot of training in, but if you have, I'd love to hear from you. It's called task initiation. So, these are a few questions to just ask yourself as an educator if you have a student that might struggle with task initiation. This is partially related to procrastination. And for some students, they may really struggle with becoming a self starter, where they don't know where to start, where to end, and really teaching students that it's okay to ask for questions, to ask for help. Strategies that you can use as an academic person is helping students maybe make things more visual. It talks about in this literature using visual aids. If you notice that students are struggling with this, providing plenty of encouragement and praise is absolutely talked about in this literature. And providing opportunities to transition and practice whatever skill that you're teaching them in the classroom. For some of these students as well, they may struggle with transitioning from topic to topic, subject to subject. Sleep and fatigue are a huge topic to take into account in the general population, but also you will find numerous studies that talk about this within the context of college students. So let's pretend you're working with a student who has a lot of daytime fatigue. The research literature points to the fact that chronic daytime fatigue can mimic or contribute to more learning problems. There is some evidence to point to the fact that this can accelerate test anxiety for some students. Some students can really appear very distracted in the classroom, almost look like they have ADHD, but it could be more related to chronic fatigue. Chronic fatigue can also contribute to more memory problems, more confusion. And if you ever work with students that have a high degree of irritability or lots of up and down mood swings, high levels of daytime fatigue may be a potential contributor to those kind of behaviors as well. I'm just going to park the brakes for a second and see if we have any thoughts, questions, concerns on any of the information I covered in that first section. Looks like we have a question in the chat box. Can you explain the gut-brain connection and how this relates to autism and student performance? Oh, you bet. Great question. The research on digestive health issues, the gut-brain health axis within the context of autism points to the fact that more than 90% of people on the autism spectrum have something going on that is not working properly in their digestive health system. It's called gut dysbiosis. So if you ever hear someone say the word gut dysbiosis, that is basically an indication that the gut is not working properly. When the gut is off, how does that impact student performance? This could be with a student with autism. This could be a student with any kind of special needs population or a student that doesn't have a disability. Most of our serotonin is produced in our gut, and the gut is the hub of immunity. So if the gut is off, that has been linked with more anxiety, more depression, more inflammation in the body. It is a very interesting topic to be aware of, and it's highly likely, based on the available research, that a higher number of college students may deal with some level of gut dysbiosis. The very nature being, again, going to college can be more stressful, not getting proper sleep, the way we eat can impact this. These are all things that can impact the gut. The gut is a big, big topic. I've given a lot of podcasts on this too. So shoot me an email if you'd like me to shoot you some more resources as well. Looks like we have another question about also how is it recommended to address food insecurity? There's a number of actually articles that have been published on that within the college realm. And some of these articles actually call upon academic institutions to routinely screen for this as students enter into that college environment. So, first way to address this is just to identify the problem. The second way I think to address it is to maybe have some training on the topic for your faculty just to alert them to that this is even a problem. There are a number of studies too that point to the fact that maybe as many as 30, 40, or 50% of college students may be dealing with some level of food insecurity. And unfortunately, that number might be higher for students with lower socioeconomic status. They talk about the use of food pantries at times on some college campuses. Sometimes they talk about colleges offering cooking classes and other kinds of community-based resources to help address this. It's typically more of an issue among four-year degree students, but it can be an issue among graduate students as well. So great questions. Thank you for that. I'll come back to a few more questions in a few minutes. We'll just get through a few more slides, but keep the questions coming. I'll stick around as long as we need after to answer any questions. Self-efficacy is a major topic we need to be aware of. When students have lower levels of self-efficacy, they typically are not going to have a high belief in their own ability to complete the tasks required of them to be successful in college. Higher levels of self-efficacy have been linked with more positive thinking, greater levels of self-esteem, higher levels of positive emotions, and a greater likelihood that somebody is going to achieve their goals. Targeting self-esteem is a very important topic to be aware of because if someone has low self-esteem, they're typically going to have negative thinking about themselves. They're going to have poor self-evaluations, and this can definitely erode their confidence and it might get in the way of motivation and completion with a task or whatever they're doing within that classroom. For some students, depending on the student's background, particularly students that are dealing with a high level of stress or a high level of trauma, and even chronic sleep deprivation, that has been linked with greater levels of rumination. And if you're not familiar with this topic of rumination, think of it as a problematic thinking style where somebody gets fixated on something negative, where it almost grows and grows and grows, and they just can't let it go. Rumination has been linked with more impaired thinking, negative problem solving, and it can accelerate anxiety and depression among some individuals. Without a doubt, you will probably be working with some students that have a high degree of social anxiety. Some evidence points to the fact that people that have high levels of social anxiety look through a trauma lens, look back in their life. Bullying histories might be more common, more childhood trauma might be more common. People with true social anxiety may be more avoidant in the classroom. You might notice this on a day that you're giving, where students have to give like presentations to the class. People with true social anxiety may have a panic attack. They may not show up that day. They may run out of the classroom. These are extreme examples, but it is something we need to be aware of. If you've ever worked with students who are high on this spectrum of being perfectionistic, this can accelerate stress, and this can absolutely impact one's thinking and their ability to just process emotions effectively. If you're working with someone who's a true perfectionistic, they might be very self-critical. They may set very impossible standards for themselves. They may have a fear of failure. They could be very hypercritical of other people as well. And you may see more self-defeating thoughts and behaviors among some students that have these high degrees of perfectionistic behaviors. We won't spend a lot of time on this. I'd encourage you to take a look at the recording I did for Hawk's Learning just on this topic, but just know that academic procrastination is very, very common among college students. This is a huge threat to success in college as well. This is a topic, one of my favorite topics. I give lots of talks on this. Go online, you can Google my name and type this in. You'll find a handful of articles and multiple podcasts. But this is a topic that if you're working with students that have had a high degree of trauma or mental health challenges or drug and alcohol issues or even chronic sleep issues or burnout, alexithymia, this is a trait that is actually quite common in the general population, but it's even more common among people with certain diagnoses, and even professional burnout has been linked to this. Basically, what this is a person really struggling to manage their emotions and name them and label them. This can be a huge barrier for students being able to just interact with other people effectively. And if you're in a classroom and you ask students with alexithymia a lot of how and why questions, a lot of times people with alexithymia can have a hard time answering that because of deficits in the area of introspection and sometimes self-awareness. You would be shocked to learn, if you are not familiar with this research, of how many studies have also looked at adverse childhood experiences among college students. Basically, what this is experiences of trauma before the age of 18. Why should you care as a college professor if you're working with adult learners? Because high levels of childhood trauma, if gone untreated and unaddressed, there's a much greater likelihood that that individual, as they become adults, has more depression, more anxiety. It's been linked with all kinds of learning problems. These are just a few things to take into account. This basically relates to lack of perspective taking and empathy deficit. So if you are in a classroom and you are working with a student that really struggles with perspective taking, they seem to really struggle working in a group or a team environment, they may be dealing with something called theory of mind. This relates to our ability to understand internal mental states of other people, like thoughts, wants, needs, emotions, and tensions. If you're ever working with a student who just seems really checked out, apathetic, spacey, you ask questions and it's kind of like deers in the headlights and that student never responds to you. I'm not saying always, but they may be dealing with something called sluggish cognitive tempo. This relates to more daydreaming behaviors, lack of motivation. They're just slow in their responses. This is a real thing. It's a fascinating topic. And self-awareness deficits is another big topic. You might see this more if you're ever working with students that have a lot of mental health challenges or some neurocognitive impairments. It is definitely something to be aware of because having lack of self-awareness has been linked with more poor academic outcomes and performances as well. Basically, what this is would be maybe a student has a really hard time monitoring their own behaviors, their thoughts. They just blurt out answers. They're not aware of their surroundings. Those are self monitoring deficits. And this adaptive functioning is just a fancy term for how somebody functions in day to day life, like money management, personal hygiene, showing up to appointments on time, remembering to eat, remembering to turn off the stove, how you fill out a job application. Those are all examples of adaptive functioning. Apathy is a symptom of depression, but it doesn't always have to be associated with depression. But apathy could be a student that just shows really a lack of concern or a lack of interest or a lack of motivation, and they just come off very indifferent. This can get in the way of motivation as well. Locus of control, you have internal locus of control, which is good. External locus of control, probably not so good. People that have higher levels of internal locus of control typically are more successful in life and believe in their own abilities. People with external locus of control are always relying on external sources to help create happiness for them. If you work with students who are dealing with poverty, homelessness, lower socioeconomic status, the very nature of a student dealing with those kind of factors has been shown to wreak havoc on the body and it can impact sleep. This is basically related to more like biochemistry or neuroscience, but just know students that deal with a high degree of poverty or even homelessness, that can wreak havoc on their brain and body. And for some students, they may be dealing with some of these problematic coping strategies. So if you're noticing these patterns, if appropriate, maybe that student would do well working with a counselor, a therapist, things of that nature. As we get into tips, strategies, and solutions, we'll move through this next section quickly. But do we have any other questions on that first section that I can answer?
Yep, we have one that says, can you explain gut-brain connection and how this relates to autism and student performance? And is there any research on performance improvements given dietary changes?
I answered most of that just a little bit ago, but in terms of research on performance improvement, I'm not giving medical advice here. Always consult with a medical doctor, a qualified nutritionist, but there's some literature that indicates that sugar reduction can have a huge impact on this. Avoiding eating the Western diet, maybe having more of an adherence to the Mediterranean diet. Lots of studies have shown that probiotics can be helpful, but it's really complicated because everybody's wired differently. We all have different biochemical individuality. So send me an email. I literally have hundreds and hundreds of articles on those kinds of topics. So great question. Thank you.
No problem.
Tips, strategies, solutions. I am a major fan of just looking at it through a positive psychological lens. So whatever kind of situation you're approaching, I always think it's helpful to utilize gratitude and optimism and resilience and hopeful thinking. These are all things you'll find in this literature. Gratitude is the quality of being thankful. It has been linked with helping people reduce stress and helping people improve sleep. If we get in the habit of just having a mindset of gratitude ourselves. That's been linked with a reduction in burnout. It can help with career advancement. It can help improve our own empathy for others as well. So, having a mindset of gratitude, there's so many health benefits associated with that. The topic of grit often comes up in this literature as well. And there's some studies that have shown that grit can be a really powerful motivator for college students. So, grit, think of it as that student's effort or consistency or their ability to just hang in there when things get tough rather than throwing in the towel when there's a lot of stress. If you look at the grit literature, it's been positively associated with improved academic performance, greater levels of self regulation. For you as the professional, if you're a professional listening to this, having higher levels of grit within the workforce has been linked to a reduction in work related burnout. So, this is a big topic too to take into account. Having a mindset of optimism oftentimes relates with gratitude, but optimistic attitudes and behaviors, if you as the professor, the instructor, can come off very optimistic, that's more like hopeful thinking. It's been related to an increase in resilience, and optimistic viewpoints and behaviors have been linked with greater levels of enthusiasm, creativity, and self confidence, to name a few. So, optimistic views can be very, very helpful to use as well as part of the teaching instruction process. Promoting joy or just understanding the joy literature can be very helpful as well. And maybe, if appropriate, if it fits in line with your curriculum, giving a lecture to your students on these topics just to introduce them to some of these topics can help some people shift their mindset into more of a hopeful mindset. The more I learn about these topics, the more I'm self aware and trying to be intentional with the way I think and how I act to myself and other people. Joy is a little different than happiness. Joy is more innate. Happiness might be more based on external factors, not always. But if you can cultivate a sense of joy, you can really stay optimistic even in the face of adversity, hardship, trauma. Having higher levels of joy has also been linked with greater levels of empathy and self compassion. We'll talk about self compassion in just a minute. So, when you think of self compassion research, if you haven't studied this, this is a really important area of study that can be helpful for regardless of what job you do. When you think of self compassion, this is basically self directed warmth or empathy. It's just being kind to oneself. So if you ever screw up, make a mistake, someone who's self compassionate can let that go. Shame doesn't kick in. We typically can develop greater levels of resilience and self confidence, and having a higher degree of self compassion has been linked with overall well being. And it's actually been shown to help improve our coping strategies as well against stress. This is one study of hundreds in the self compassion literature, but I wanted to visually just show all of you again the benefits of having a mindset of practicing self compassion and even encouraging students to start engaging in this kind of mindset. It's been linked to so many things. You will find in this literature that it can improve physical fitness. It's been linked to lowering inflammation in the body. And if we can lower inflammation, we might not get sick as much. It's been shown to be helpful in helping people reduce physical pains. So having a higher degree of self-compassion can actually maybe reduce physical body pain as well. And the list goes on. You'll find some studies that talk about greater degrees of self compassion. People are in a better position to make more informed decisions around their own health practices. So they might be more likely to eat healthier, exercise, manage stress in a much more healthy manner. In health promotion, I'm always a big fan of just promoting health and wellness. Health promotion is a whole line of research literature you'd want to be aware of. And when we think of health promotion, it's divided into these subcomponents. How responsible are we for our own health decision making? Are we proactive with checking in with our doctors? Do we go to the dentist? Are we living a sedentary lifestyle, or are we trying to get out there and move more and get exercise? Being very mindful of what we eat, how we manage stress. Self actualization can be very helpful, self efficacy, self awareness. Metacognition, I would definitely learn more about, as we talked about before, and really focusing on relationship enhancement as well. Really taking an interest in community and being around people and not isolating. These are some of the things that are talked about in the health promotion literature. And if we can practice these, and none of us are perfect, obviously, but if we can practice these continuously, it's been linked with enhanced well being. And if you look at the enhanced well being literature, that's been associated with helping people lower their blood pressure, improved immune functioning. So if you ever worked with people that get sick a lot, working with someone that understands this may actually help improve their immune system functioning. Really interesting. By having enhanced well-being too from a student lens, that will likely contribute to more motivation to do well in school. Again, none of this is ever going to be 100%, but if you look at this research, enhanced well-being has also been linked with improvements in creative thinking and problem solving, and even an enhancement in cognitive functioning, which is basically brain-based functioning. Healthy lifestyle behaviors is a whole line of literature as well that is very similar to what I just spoke about. But when we think of this moral improvement, this relates to like moral judgment, moral reasoning. Does the individual have very good ethics? What's their level of integrity like? People with higher levels of integrity, better ethics, as a whole, typically live a healthier life, not always the case. And again, the health responsibility, how proactive are we? Do we take an active interest in learning about health and wellness? Do we have good health literacy? Do we know how to read labels, nutritional labels, things of that nature? Basically, these are just different healthy lifestyle behaviors that are pretty common sense. And then when we're talking about this through this well-being lens and all of these threats to academic performance too, the research literature also talks about the importance of really trying to help people avoid risky behaviors. And unfortunately, among some college students, they may be more likely to use alcohol, drugs. We know again from the research literature that college students may be higher consumers of sugar sweetened beverages, fast food, energy drinks. These are all threats to our health and wellness. And again, if you're a college professor, I know you're not going to necessarily like try to help a student lose weight or eat a better nutritious plan, but these are things to keep in the back of your mind, having more awareness on your campus, maybe having people, professionals who have competencies in these areas where you know where you could refer a student to if they're asking about these things. These are all things to take into account. And we all know the benefits of exercise. It's pretty clear from the research that exercise really is therapeutic and it really is a type of medication. And I know some of you probably work on college campuses where there are exercise programs. So that would be a good resource to tap into if you want to learn more about physical activity and exercise and the importance of reducing a sedentary lifestyle. But the benefits of exercise, it can increase student motivation. It can have a profound impact on sleep health. It's been shown to reduce stress, anxiety, depression. Interestingly, too, physical exercise can improve bone strength and muscular skeletal health, and the list goes on and on and on. So the benefits of this are absolutely many and varied. Really promoting positive thinking styles, positive coping strategies. There's all kinds of things out there to think about, but if we look at this through that positive psychological lens, Forgiveness interventions come up. Maybe some students are really hanging on to something, they can't let it go. Maybe they need to work on some self-forgiveness in some cases. Maybe a student is really trying to stay sober and they're really having a difficult time avoiding alcohol. Maybe they do well joining some sort of support group. Maybe you know a student that just falls asleep in class all the time and they just cannot ever stay awake. If appropriate, again, talk to your supervisors, make sure it's in line with your policies, procedures, and practices, but maybe just asking a few questions to that student, kind of what's going on. Have you ever talked to a doctor? Would you like to talk to the school counselor? If you notice that student is just pounding down the energy drinks day in and day out, or the sugar sweetened beverages, maybe encourage them. Have you ever considered talking to a nutritionist, something like that, if appropriate? Again, we're kind of dancing a fine line with some of these topics, but it is definitely important to be aware of because, again, all of these topics can be threats to academic performance. Maybe you know students that really struggle with having healthy boundaries, or they struggle with limit setting and they can't ever say no, and they take on every task under the sun, and they're involved in every single volunteer activity. On the surface, that seems like a good thing, but are they burning themselves out? Is this contributing to more anxiety? Is it contributing to that person really falling behind and now they're starting to deal with academic procrastination? If we have any mental health folks in the crowd, or college counselors, or anyone that works in this arena, I highly recommend really learning about some of the neuro counseling research literature and send me an email. I have a lot of good resources on that as well. These are some of the lifestyle factors that are talked about in that literature. And again, a lot of these things are pretty common sense, but exercise, nutrition, getting out in nature more, focusing on relationship enhancement, and interestingly, even being an owner of a pet has been shown to improve mental health. So we talked about the gut a little bit before. I would honestly, if you, whatever field of study you're in, if you can at least learn the basics about the gut brain health axis, I think it'll change your life. It has really changed my life in terms of helping me better understand human behavior, human disorders, human diseases. I do a lot of consultation, as I mentioned, on a variety of topics. And when I look at it through this gut brain health access lens, it really can help me better understand why some clients or situations that person may be dealing with more behavioral problems, more learning challenges. This is a big area of study that is emerging, and it has significant implications for learning, attention, and memory, just to name a few. When we talk about the positive side of things, again, I'm a huge fan too of strengths-based approaches. This is really capitalizing on that student's strengths, their abilities, their hobbies, their skills. Now we want to be aware of limitations and weaknesses and barriers, but we really want to capitalize on the good stuff and really focusing on empowerment. That can really help students feel more motivated and encouraged. Equally important is promoting resilience. And you will find several studies too that talk about the importance of promoting resilience, not only in the classroom, but in that entire organization. If organizations are more resilient, they're more flexible, they can bounce back from tough stuff. Burnout is typically reduced. Resilience is a very important positive protective factor. And I encourage you to tune in next month for the training I'll be doing on executive function. We'll dig deep in the weeds on this, but again, this goes to the heart of academic performance, goal planning, and learning. The more you can learn about executive function, I think the better off we're going to be. And we talked about self-esteem before, but I wanted to just remind all of us of how important it is to be aware of this dynamic of self-esteem, because some students may be dealing with some self-esteem issues. And when self-esteem issues are at play, this could contribute to more self-regulation issues. This could trickle down into having some more motivational deficits. It's a big topic for us to also be aware of. And again, the metacognition before, I'll talk more about that too next month. But again, this is thinking about thinking, knowing about knowing. It relates a lot to self-awareness. And if you look at this research literature, it talks about using metacognition training approaches to help enhance student learning and student performance. So we spoke briefly about internal locus of control before, but if we can help students develop a greater level of internal locus of control, that has been linked with greater levels of self-esteem, higher levels of motivation, improved problem solving abilities, and greater levels of reflective thinking, just to name a few. This is very common sense, but you will find a whole line of literature that talks about mattering, just making your students feel like they matter and they're heard and they're significant and they're appreciated and they're valued. If you can do that, that will absolutely lead to improved outcomes. And when we're talking about some of these things too, there's a whole line of research literature called savoring. If you're a counselor or therapist listening to this or any kind of skills coach, you're probably aware of this, but just helping people learn how to savor the moment more and focus on the positives has been linked to all kinds of positive health benefits as well. And depending on what kind of class you teach, if appropriate, journaling is fantastic in terms of just helping people be more reflective, be more mindful, thinking through things. Reflective journaling has been used in all kinds of settings and organizations for a variety of purposes. I'm a major fan of emotional intelligence literature as well. If we can infuse emotionally intelligence informed approaches into the teaching practices, that has also been linked with several positive outcomes. These are the basic components on this slide about emotional intelligence, and we talked about many of these today. And as we wrap up on this last slide, again, really focusing on our own self-care. Whatever position you're in, if you can focus on your own self-care, hopefully that will reduce burnout, make us more effective in what we do. We might have greater levels of self-compassion for ourselves. And this can trickle down into being more hopeful, more optimistic, and just helping students thrive in terms of academic performance and success. So, as I mentioned before, I threw a master's degree worth of topics at you in less than an hour. I know it was a lot, but I will stick around as long as we need to answer any questions, thoughts, concerns, and you have my email as well. Reach out, please, anytime, and I will get back to you and I'll share my slides with you guys as well.
Thank you.
Yeah.
While we wait for questions to trickle in, would you mind going back to the slide that has your email address on there? We have several people asking for it.
Yeah, you bet. Let's just move it up here. So first line just right here. And yeah, always get back to folks in a timely manner. So
One of the questions we have is how does blood sugar regulation impact student education and learning? I know you
so
touched on it a little bit, but if you could go into more detail.
yeah, so we spoke briefly about that. The question sometimes comes up is again, why should I even care about blood sugar dysregulation? Because if our blood sugar levels go too low, that can contribute to something called hypoglycemia, which is mean lower blood sugar levels, which is an indication that our glucose levels in our body might be a little lower. And glucose is metabolic fuel. We need glucose as human beings to function, and our brain, that's the fuel for our brain. So if we don't have enough glucose, our brain is not working at optimal levels, and that can slow our thinking down. It can impact our mood, our energy. And if we are dealing with high blood sugar levels, that can be equally problematic. And that is more linked to hyperglycemia. A lot of times people always think this is studied only within the context of like diabetes, but blood sugar dysregulation is very common among all of us. If you skip breakfast every day, you're likely your blood sugar levels are dipping a little bit. If you are pounding down the sugar sweetened beverages, you're likely spiking your blood sugar levels. This can have a very negative impact on brain health and body health. So that is kind of it in a nutshell. Google my name too. I've done several podcasts on blood sugar dysregulation if you guys want to learn more about that topic.
Thank you so much.
Yeah, you're welcome.
All right, that looks like all the time we have for today. Thank you, Jared, and thank you all for attending today. We will be emailing you a link to view the recording of this webinar once it becomes available. If you or any of your fellow instructors are interested in presenting for our Learning and Growing webinar series, please submit your proposals to the Learning and Growing website, which I'm going to go ahead and link in the chat right now for easy access. These free webinars are brought to you by Hawks Learning, an innovative educational courseware company. To learn more about our mastery-based course materials and how Hawks can enhance learning outcomes for you and your students, please visit hawkslearning.com, and I hope everyone has a great rest of your day. Thank you all for attending.
Thank you, everyone.